Thank you for joining us. So next we will hear from Clayton Clark, the general manager at Green Mountain Transit. Clayton has served as the general manager of Green Mountain Transit since January 2023. Prior to that, he served as a mission support officer in the United States Air Force, managed a variety of human services programs for the state of Vermont, and led a long-term care facility during the pandemic. He has a bachelor's degree in English from SUNY Binghamton and a master's degree in government from Harvard University. Clayton is going to share a brief overview of Green Mountain Transit's proposed service reduction plan for the next 30 minutes, which many of you may be aware of. And he's going to share how this plan moves forward, the process, and into the upcoming legislative session. And he will have time for some questions and discussion with the audience here today. And GMT does have an exhibit table in the fireplace lounge with further information. And what we're displaying here, Clayton can tell you more about. Clayton?
Sandy? There we go. Good morning, everybody. If I talk from you down here, I won't be nervous. If I'm up on the stage, it's gonna be scary. So, I wanted to start off by talking about something that we should appreciate, a little bit of appreciative inquiry. And the first thing I want to do in my appreciative inquiry is talk about CATMA, because not only does CATMA do the work here to have this summit, but CATMA is a critical partner for Green Mountain Transit because about 20% of our fare revenue comes from the agreement that CATMA helps negotiate between the University of Vermont and Champlain College. And so that's how these two big institutions get service for their students, faculty, and staff while also supporting a broader network that supports the whole community. So I want to make sure that people know that CATMA is a critical partner for GMT and meeting our financial goals. I also want to talk about how lucky we are to be in Vermont, because Vermont really shows with its actions how it supports public transit. And so earlier this year, there was a report to the legislature that took a look at all of the rural states, and defining rural states, that's a state that has 40% or more of its population in a rural area. And when you look at the per capita spending on public transit when it comes to state taxpayer dollars, Vermont is at the top of that list. Our state government contributes $13 per person towards public transit. The next state on that list contributes under $3. So we're talking about a huge commitment that the legislature and VTrans has made to public transit, and I want us to acknowledge that. VTrans in the legislature also does something that's super critical for all the providers in Vermont, and that is that they also, in addition to using our state funds, we flex more federal dollars towards public transit than just about any rural state. And in a lot of the metrics, we're at the top for transferring these funds. And so what that means is that there is a conscious decision on the part of the legislature and VTrans to take funds that could be used towards roads and bridges and put it towards public transit. And so we need to acknowledge that the legislature and VTrans, makes these decisions. And so I want to make sure when we start talking about the bad news of my presentation, because it's not going to be all fun, that we know that we're starting from a position of support and strength. I also want to talk about how important our municipal partners are. So the city of Burlington, its 45,000 residents, contribute about $45 per person per year for our public transit. That is a huge investment, and I appreciate that from the state, with the administration and VTrans, from the legislature, and from our municipalities, there's strong support. And so, what does that get us? Well, I'll tell you what it gets us is when you look at our urban service, there are 320 small urban transit agencies in this country. And each of these small transit agencies are measured by the federal government across 6 measurements, and they award additional funds for each measurement that you're above average. We are above average on 4 of the 6 measurements. To give you an idea of what that means is that the investment that the state and municipalities have made has created an urban system that is at the 89th percentile as far as the major performance metrics. So our small city transit is really some of the best in the country for a community our size. And so I'm glad that we're starting with that from this place of strength. And we're going to talk a little bit about the service reductions or the potential service reductions in a moment. But I want to also talk about something that may be kind of under the radar for folks, unless they're sort of transit geeks that are really, paying attention to the GMT's Board of Commissioners meetings. And that is that one of the things that we're considering is GMT itself. So outside of California, there is only one other transit agency that we could find that has both an urban and a rural mission. And the reason why this matters is because the federal government funds urban and rural transit through separate programs. And these programs are siloed. And we heard from the mayor about how, nobody likes silos. Well, we don't like silos because silos are what keep GMT essentially 2 separate transit agencies that share a common management team. And about 20 years ago, the state was in a very different perspective when it came to public transit. We had rural providers that were struggling, and some of them were failing. And GMT sort of stepped into to take over service in some of those areas. The good news is that fast forward 20 years, and rural transit is not struggling like it was, it's thriving. And this has made GMT, VTrans, Tri-Valley Transit, Rural Community Transit, our local adjacent transit providers to think about, now that the health of rural transit has improved, does it make sense for GMT to continue to be this special unicorn? And I can tell you that when I was a kid, man, I always wanted to be special. But now that I'm an old, mature bureaucrat, I have learned that, sometimes special isn't always awesome. And so I want to let folks know that right now we are considering whether or not GMT should stay in its current form, providing service across 5 counties, or if we should return to our urban mission, which is the mission that we had prior to 20 years ago, which was focusing on local service in the Burlington and adjacent communities. So I wanted to let you know that that is happening, and you may see something in the news in the coming months, and perhaps even during the legislative session about this. But let's talk about what's on the screen. So we are in a situation where, despite all of the good efforts of the legislature, VTrans, and our municipalities, that we have a funding gap that will start in fiscal year 26. And so for GMT, that's July 1st of 2025, so in about 9 months. And we have, our projections show that there's about a $2 million gap between our income and our expenses. Now, we've had a gap for some time, But we've been very lucky because one of the few things that came out of the pandemic that was positive was additional funding for municipalities. And so GMT as a municipality received these additional funds, and that meant that we were able to continue providing our current levels of service despite the fact that our costs were growing at this rate and our revenue was growing at this rate. So revenue is still going up, but just much slower. The problem with one-time funds in public transit is that they run out. And so we're going to run out of these funds sometime in the next year. And that's why we're going to have to learn to either live within our budget or to generate new revenue. So because of the GMT board has a legal fiduciary responsibility to the organization, they have had to consider something that none of us want to consider, and that's reducing service. We all came to GMT, whether as an employee or as a volunteer board member, because we believe in public transit. We believe in the interconnectivity of public transit. And none of us joined because we wanted to restrict the services to our community. And so the board, despite finding the process to be distasteful, which I also find distasteful, we had to consider reducing our service in order to meet our budgetary restrictions. And so in August, we presented to the public a plan that could potentially reduce our costs through service reductions by about $3 million. The good news is that our current gap is only about $2 million, so that we know that unless our projections change significantly, which can happen, because if the price of diesel goes up $1, that's $350,000 out of my budget. So knowing that future predictions are always unpredictable, at this time we know that the gap is only about $2 million, so we're not going to have to consider all of the service cuts that we are considering. The service cuts would be laid out into 3 phases. The first of which focuses on the Jeffersonville commuter and Saturday service. And here is where I want to know, were tomatoes distributed to the audience prior to me coming up? Because I'm a little nervous about letting you know that earlier this morning at GMT's Board of Commissioners meeting, we did enact service reductions that will be effective in December. And that these will result in the elimination of the Jeffersonville commuter that connects Jeffersonville to downtown Burlington. And it will reduce service on Saturdays, primarily by reducing frequency and reducing the span of the day. But unfortunately, that would also include eliminating the entire Saturday service on the number 10, which connects the town of Essex to Williston. I can tell you that it was included in the motion, that the board regrettably is improving this, because it's not what they're happy to do. There was nobody there that was excited. So that's the first phase that would happen in December. The next phase that would potentially happen in February or March will focus on commuter service, looking at the Montpelier link and the St. Albans link. What we are proposing is to combine the St. Albans link with the Milton commuter. Currently they operate parallel to each other, with one going down 89 and one going down Route 7. We're going to consolidate those into a single run. And we will likely reduce the number of runs on the Montpelier link. One of the reasons why we're doing this focus on commuters is because of ridership being low on the commuters since the pandemic. We have seen a return in ridership on our local routes, but have not on our commuter routes, and they're about 50% the capacity. So the system was built for moving twice as many people. Now that we see that it's not going to come back, we have to consider whether that level of service is sustainable. Lastly, in June, we would be considering local cuts that would be more drastic. So I'm going to tell you something that's going to sound kind of stupid before I turn it over for questions. And that's where I'm going to tell you why I'm optimistic. How could I be optimistic? You just cut service today. The reason why I'm optimistic is because of the public meetings that we had. So we had 9 public meetings, and I was at all of them, moderating them. We gave space for every person who attended to talk about their story, to talk about how transit impacted them. And what we heard is not going to surprise any of the people here. Of course, we heard about its critical component of getting people to work and how it helps with our labor scarcity problem. We heard about how it gets people to places that has housing that they can afford, and so it helps our housing problem. We heard about people who use it to get to their healthcare appointments, and so it helps our whole healthcare system. We heard that it is getting people to human services appointments. It's getting them to methadone clinics so that they can stay independent, so that they can stay healthy. We heard from planning departments who had approved housing along routes that had reduced parking requirements because it would be on public transit. And now some of those routes are potentially going to be reduced. We heard predominantly from folks who use public transit because that is the method of transportation that they can afford. And when I hear somebody tell me that if, the example that just really caught my attention, somebody came to one of our public comments and said, if you move the 11, I'm going to have to move. And if I have to move, I'm not staying in Vermont. That worries me because my job now, the job that I had in long-term care, was all about labor scarcity. And the reason why I'm optimistic is because many of the people that attended these hearings were our legislators. And what I heard from them is that this issue transcends the transportation committees. We have heard from likely members of the healthcare committee that they want to take testimony on how service reductions is going to impact the ability of their patients to get to care. We've heard from the Human Services Committee that they're going to want to know how service reductions are going to impact their efforts to keep people healthy and to keep people independent. And that if we do cut service, that's going to be a cost shift to less efficient modes of transportation, where service providers like the Howard Center are going to be spending more time moving people instead of helping people. I expect that folks at the State House interested in housing, on economic development, on climate, are all going to have opinions here. And something tells me that when we see the broad-ranging effects of service reductions, that we'll have an opportunity to do something that hasn't happened in 20 plus years, which is that we have studied over and over how we need to have a sustainable public transit financing mechanism. And there has not been the political will to get that over the finish line. But now we see the cost of not being able to get over that finish line and the breadth of that cost across just about everything that we care about. And so that's what gives me optimism. So sorry that took a little bit longer to walk through than that I'd hoped, but I would love to answer questions, And I know that in a group forum like this, that can be kind of difficult. I have a microphone. If you want to raise your hand, I'll come to you. Sandy will probably get a microphone as well. And I'll have a lot more fun responding to your questions than I will speechifying to you. So, who wants to start? Here we have, right here. Thank you, Sandy.
Thing?
There we go.
Good morning. I'm Mary Krogan from Tri-Valley Transit. I don't know if you had much feedback from college students, but since we're here at UVM campus today, I thought it was very appropriate to mention that, Middlebury is also a college town, and I get so much feedback from students that having a robust transportation system makes it possible for them to attend school out of state without bringing a car from out of state here.
Yes.
So one of the ripple effects of cutting service is likely to be more out-of-state cars
Yes.
parking on campus and using our infrastructure. And the other point I wanted to make was there's also a current move to centralize specialty care. Like little hospitals are looking to save money by having certain procedures done out of county. I know that's going to have a huge impact on our transit system, and that's something we have to gear up for. That's it.
Thank you so much. And thank you so much for doing something that really helped GMT, which is that earlier in the year we came to the decision that it would be better for Tri-Valley Transit to operate the 116 commuter that connects Heinsberg to Burlington. And unlike most of the other service cuts that we are considering, it was so good that there was a replacement service available that would be able to provide cost savings without reducing or degrading the service. And I wish that there was opportunities across all of our routes to do that. I want to touch upon something that, or expand upon something that you mentioned, because with my background in human services, I think about transit a little bit differently than probably most of the people that work in transit, and that probably drives the GMT staff nuts. But one of the things that I think of is that we need to have GMT forward thinking when it comes to services in the community, because it's really not very effective to provide a service somewhere and then think about public transit. It would make a lot more sense to provide services where public transit is. And one of the things that I would like to see GMT move towards is that in the future, when we do have opportunities to work on new transit centers, that we incorporate human services support, right into the transit center. How about having the food shelf at the transit center? Then everybody can get to it. How about having, all sorts of range of preventative and healthy systems so that those folks who struggle with getting around can access care right as part of their daily, commute. Oh.
Hi, Carol Ricciuti from Working Fields. We're a mission-driven staffing agency that supports anyone with any sort of barrier to find employment. And the number one barrier for our motivated job seekers is transportation. I'm curious, with your human services background, if there's been any thought for Green Mountain Transit to provide transportation to employers that are not currently on the bus route. Keurig, Blodgett, Dynapower. So we work with all of these employers, and I can tell you that it's so frustrating when we have motivated job seekers that want to work and we're not able to get them to work. The closest bus stop from Dynapower is a mile walk, which is difficult in winter.
Absolutely.
Thank you. And thank you for all that you and your team do every day.
Thank you. And I love it when a LinkedIn friend that I've never met is right there in front of me. So yes, great question. So, one of the things that I think GMT needs to work towards in the future is being more like the rural transit providers. Our statute allows us to assess our local municipalities to get our local funds. And that is a wonderful power. But I think it's a power that we have over-relied on, because the other transit providers don't have that power. And what that means is that they have to hustle to work to get local match. They have to talk to employers and say, hey, we're going to provide this service for you if you contribute some local match. And I think that GMT, and it's going to be hard because we're not really staffed to have that type of forward first approach. We're in a reactive mode because of our low staffing. But we need to get to the point where we are then approaching organizations like that, following our rural counterparts, where we see opportunities in the area, and instead of just going to VTrans or our municipalities and saying, hey, we need more funds to support these, we need to work with these employers, and in some ways follow the CATMA model of having the people that would benefit from transit contribute towards the transit, and then be able to add to it. Because, right now we're talking about downsizing. The reality is that government organizations, downsize and upsize is just a part of natural cyclical things. And so it's depressing and sad right now, but there will be a time, when we think about expansion and providing better service. And that would be, when we would want to do things like that. Oh, last one. Sorry for talking so much. Oh, here we go.
You forced me to. Sustainable Transportation Program Manager here at UVM. Twofold question. There were several strategies that were recommended to sustainably fund GMT. Wondering if GMT is going to weigh in on any preferred method to fund GMT. And then second question is how GMT is thinking about microtransit, if that's in the future, to be able to fill some of these gaps that don't have consistent demand.
Great questions. And I'll probably need help with remembering both of them because my brain is fried after that 7:30 a.m. board meeting. When it comes to the which funding mechanisms would be helpful, I mentioned that there was a study that was done in January. They identified 4 potential revenue sources that would be dedicated to public transit. I know, and I don't want to speak out of turn because I don't have permission from this legislator to do so, but I know that there is a legislator that is planning on reintroducing legislation that would have a addition to the car registration fee. And one of the things that I should mention is that GMT Urban is going to be the first to go over our fiscal cliff. But VTrans and the rural agencies are not far behind us. And so service reductions are going to be a statewide thing unless we have something like this additional revenue source. And when I think about the fact that a $10 add-on to car registration fee at a time when we're trying to limit single occupancy vehicles, that would generate $7 million a year for public transit. That resolves all of our fiscal cliffs for all of public transit, urban and rural. And that to me seems like an elegant solution. And I'm hoping that the legislature will chew on it. And I told you I'd forget the second question. Oh, and yes, microtransit. So right now, we have a study ongoing because we have a system where SSTA provides our Americans with Disabilities Act transit, so folks who are disabled and unable to use our buses get rides with SSTA. One of the things that we're studying is if we should make it a combined ADA and microtransit. This is something that other other transit agencies across the country are moving towards. And the thing that we like about this approach, and we hope that the study shows that it would be cost effective, is that what worries me is regional microtransit. Like, I wouldn't want there to be a Williston microtransit, and then a Winooski microtransit, and then a Shelburne microtransit. And if we do this as part of our overall ADA system, then it would be more of a regional microtransit that would be helpful for everybody. I will say, though, that that's probably, you know, a year or two down the, or probably 2 years before we'd even think about implementing. And certainly our financial position is going to, you know, play a factor in whether we can move towards that. And I don't want to get in trouble with Sandy, so I'm gonna turn the mic back to her. Thank you so much, everybody.